So today, to help us understand more about the bone DEXA, on set I have Dr. Mustafa Baiji, who is a consultant radiologist. Welcome to the show.
Thank you so much.
I have also Dr. Tasneem Hassan, who is a general practitioner right here at Rehan. Welcome to the show.
Thank you.
Yes, and we are going to discuss more about the bone DEXA. And Dr. Mustafa, I'd like you to start, perhaps, to help us understand the terminology. What is a bone DEXA?
So bone DEXA is a machine that it's an imaging test, okay, which is used to diagnose bone density, okay, and this is mainly used for the disease of osteoporosis. And osteoporosis basically means osteo means bone and porosis means porous, so literally it means porous bone, okay, and the porous bone means that over time the bone becomes the density of the bone becomes less and less. Yeah, it's like holes in the bone, you know, in simple terminology, it's holes in the bone. So the DEXA machine is the one which is used to test for this bone density.
Okay. And as Dr. Mustafa has talked about now the osteoporosis, perhaps Dr. Tasneem, tell us what brings it about. Is it our diet? Is it our lifestyle? What are the risk factors?
Okay, so there are many things, yeah. There are factors that we can change, and there are those factors that we cannot change. So factors that we can change is like our diet, yeah. So if you have low sources of calcium and vitamin D in your daily intake, if you have a sedentary lifestyle, so as we know, the bones will be not active, so new bone will not be formed. So that can precipitate to get osteoporosis. If you have a tendency of smoking and drinking, yeah, so more than 3 units of alcohol in a week can predispose you to getting alcohol. Obesity, either obesity or underweight, either of them can predispose you to get osteoporosis. And then we have a family history. For example, let's say if your parents have a history of getting, like previously had a fracture, or they had a history of osteoporosis, the offspring or the child has a higher tendency of getting osteoporosis. If you have amenorrhea, in simple languages, if you have low estrogen or postmenopausal.
Oh, really?
Yes. So actually, that is the main cause of osteoporosis in our setup, postmenopausal women. Yeah, because estrogen is a protective factor for bone.
Yes, so when estrogen levels go down after your menopause, automatically your bone tends to become weaker and weaker. Okay, yeah. And when this happens, yeah, osteoporosis is a very silent disease. Okay, it cannot be, it doesn't have clinical signs, it doesn't cause you pain or anything like that. And most of the patients we get around here, yeah, are when the bone has already fractured. So if osteoporosis is not detected and it continues and progresses, yeah, patients have a trivial fall and they get a fracture, and that is, you know, it's a path that leads them to eventually becoming bedridden, and eventually can even become fatal. Yeah.
Because of the estrogen and menopause. So it means clearly most of the people who get it are of older age.
Older ages.
Can young ones get it as well?
Yes. So we have other causes of osteoporosis, the secondary osteoporosis basically. Let's say if the patient has a disease state, let's say they are diabetic, okay, so the drugs they take for the diabetes can predispose them to osteoporosis, in the sense that the drug itself can lower your bone mineral density. So once your BMD is reduced, the next thing is you get either osteopenia and then you progress to osteoporosis. Okay, something else is rheumatoid arthritis, that is quite common in the age of 40 years. Yeah. Some patients, especially during COVID, we had a lot of patients that were put on steroids.
A lot of young patients who are put on steroids, yeah, and steroid treatment is a predisposer of osteoporosis.
Oh,
yes. So in fact, recently we've seen quite a bit of young patients, yeah, maybe less than 30 years or around that,
getting it.
Yes, getting it.
Okay.
Yeah.
Yeah, you can continue.
Okay. HIV, quite common in our setup,
Yes.
lower socioeconomic state setting. For One,
Yeah.
the patients who have HIV are aging. Okay, so the age and the fact that they already have the disease can predispose them to osteoporosis. Secondly is they are on some treatments like ART drugs, for example tenofovir. Yeah, it has a tendency of reducing the bone mineral density in a long-term duration. So let's say for 1 year up to 5 years, the BMD tends to decline. Yeah. Another thing is just the disease, HIV, the virus, the protein has the viral protein and the way the virus is made up predisposes you to having low bone mineral density. Something else, cancers. I mean, he sees many cancer patients because of the CT scans and everything in his practice. Cancers is one of the other reasons why BMD, routine bone mineral density test should be done. I think Doc can elaborate more from his level of experience and the number of patients he has seen.
So many patients are on anti-cancer medication, different types. There is the oral chemotherapy agents, and then there is the intravenous chemotherapy agents. All these chemotherapy agents have shown to decrease bone density. And so what happens whenever a certain drug, some drugs are more prone to cause osteoporosis than others. So what happens is that before you start the cancer treatment, the oncologist will ask for a DEXA scan, and then as the cancer treatment is going on, there'll be subsequent scans to monitor the person's bone density index so that they don't fall into osteoporosis.
Okay, and even away from that, a lot of many patients who have underlying issues like diabetes are prone to very many diseases.
Yes.
Why is it so?
Just the way it affects our kidneys, the heart, the liver, the eyes. Diabetes also affects the bone as well. Okay, and patients who have increased levels of blood sugar in their body, especially those people who are not compliant, this has a reverse effect on decreasing the bone density, which eventually still leads to osteoporosis.
Okay. And yes, you can add on.
And to add on to that, the treatment for diabetes, some agents can also decline your BMD in a longer duration of time when taken.
Okay. So aside from that, what kind of symptoms do these patients now portray before now you can advise someone to go for a DEXA scan?
Usually it is a very silent disease.
Okay.
It's like any other disease like diabetes or high blood pressure. If you are not tested, you will not know until the last moment. So osteoporosis is similar. You will not have many symptoms, and you will most likely present with a fracture. Okay.
Oh, okay.
Yes, but there are some very subtle signs that people present with. Okay, generalized body fatigue. Okay, vague body pains. Joint pains. The knees, the shoulders, back pains, but they are not very pronounced. Okay. And I think Doc can add more.
A stooped posture. If the patient notices that,
like this.
if you notice like you're having loss of height, over a period of time. Another thing, like he mentioned, the joint pains. So me and you, all of us over here, because of our daily life and the work setup, we always have joint pains,
Every single time.
The chairs, prolonged sitting and everything, so we tend to ignore. Just think, it's a routine thing, I'm having a lower back pain, just take some Panadol, just anything, and we go about it. But little do we know is maybe the patient might be having a wedge compression fracture or a prolapsed disc, and all that, by the time they come to us, it's late, So if we can actually pick it early, or rather do routine screening with the DEXA scan, it will be good.
So how many times am I supposed to do this scan? Perhaps in a year.
Okay, so for a normal patient, a healthy patient with no risk factors like we mentioned before, they can do it every 2 to 5 years. Okay, those with risk factors, say they have a sedentary lifestyle, family history, back pains, calcium, vitamin D levels are low, or any other comorbidities like diabetes steroids, etc. The list is long. I mean, we
Yeah.
can go the whole day.
Yeah.
But for such patients, at least every 2 years, yeah. And those who are already affected, so let's say they have osteopenia or osteoporosis, then we recommend them to do every year so that we can monitor the progress of the disease if they are at osteopenia. And if they are at osteoporosis, we see if the medication they are on is actually benefiting them, you know, and whether the patient are actually improving or getting worse.
Okay, so Dr. Mustafa, once you've come and you've been identified to have that disease, can it be cured immediately? If yes, can it reoccur again?
So it's a disease that if it has occurred, what you need to do is stop the progression of the disease.
Okay.
Okay. Yes, there are several medications available. Okay, different types. We can start you on some medication, but it's a process. It's not immediate thing where in one day
It's gone.
It's gone. Yes, it's a process. You take the medications for over a period of 1 year, and then maybe repeat a DEXA scan again, yeah, and see how far you've reached.
Okay.
Okay.
Okay. So it is difficult to just cure it at once.
No. The best thing is to detect it early.
Yeah.
Okay. Do lifestyle modifications. For example, if you are detected at osteopenia, okay, maybe you just can get away with simple supplements of vitamin D or calcium, and start on weight-bearing exercises. Yeah, that will strengthen your bone and get your bone density back to normal.
Yeah, and talking of that, perhaps do we have activities that we can do at home to prevent us from getting this osteoporosis? Yes, Dr. Mustafa.
So the strength training exercises,
Yeah.
so it's just, you know, be mobile. I mean, simple, just be mobile, because if you keep sitting, sitting is the new cancer, you know, like the new research that we have right now, they say sitting is the new cancer.
I told you medical jokes are not even funny. That's what they say.
No, it's true. Sitting is the new cancer because
Okay.
it can predispose you.
So
Okay, so
aside
what
from-
exercise, what activities can they do? Just be mobile.
Yeah, be mobile and weight-bearing exercises.
So I think it's more
So
of the
own
physiotherapist.
natural body
Yeah.
weight-bearing exercises,
Like,
which are guided by either trainers
Yeah.
or physiotherapists. Yeah.
Okay.
Yes.
Is it the main reason as to why before doing the scan, you have to step onto the weights machine? We get to know your BMI, or why is it a requirement?
So, as Doc had mentioned earlier, that obesity and also being underweight are two big risk factors.
Even being underweight?
Yes, yes. So, I think Doc mentioned or is going to show you how a FRAC score is calculated.
So what's FRASCO?
FRAC score is your fracture risk
Okay.
over a period of 10 years.
Okay.
Okay, so it basically is looking at the
probably.
non-modifiable and modifiable risk factors, clumping them together, and then it's giving you a FRAC score, basically fracture risk score over a period of 10 years. So getting the BMI is part of that. Okay, if you fall into the category of mildly obese or moderately obese or severely obese, then automatically your FRAC score changes. If you're underweight, also it changes.
It changes.
Yes.
Doc, and I know you're going to take us through at the second part of the show, but you can also highlight a few things that a patient needs to know before they're coming for now the scan.
The scan. Okay,
Yeah.
so it's a simple procedure, yeah?
Okay.
No much preparation is needed. If the patient is on supplements, precisely calcium, they need to stop taking it at least 6 hours before the scan,
Why is this so?
because it tends to obscure the report. Like it will just interfere with the bone mineral density of the test.
Okay. Okay.
Yeah. Otherwise, not much preparation is needed. They can just walk in. Yeah. We take them in, do the scan. The scan roughly takes around 10 to 15 minutes.
Oh, that's a short time.
Yeah, just 10 to 15 minutes. Even the 10 to 15 minutes is by the time, you know, they change into a gown and everything. And after the procedure, the patient can resume with their daily activity, and the report will be ready for them in the next like half an hour, and they can show it to their healthcare provider. Yeah.
Perhaps someone showcases such symptoms. Is there a way that you can do it at home?
No,
Not really.
not really, because the machine cannot be moved. You know, it's done with a DEXA machine where you have to lie down and the machine does.
So that's the only process that is viable.
It is the gold standard. There
Okay.
are other portable devices that are available, however they are not accurate and
Oh,
you can't
really?
rely on them. Yeah.
And Doc, I'd like to know how accurate is the scan?
So the DEXA scan is the most accurate. Currently, it's considered the gold standard for doing a bone density tests. There are other machines also available. Okay, there are handheld devices which are portable, but they are not accurate.
Okay.
And then you have devices like the CT scanner. You can calculate bone density using a CT scanner.
Oh, you can?
Yes.
Uh-huh.
However, the drawback is that it has a lot of radiation.
Okay.
With the DEXA scanner, it's very minimal radiation, and me and you can also be in the room while the procedure is being done. It's actually pinpoint radiation, so it does not cause any harm.
Okay.
Yes.
So it is absolutely accurate.
Yes.
Okay.
Yes, yes.
And I'd like to know, after this test or even before this scan, not the test, do I need any other tests to be done on me before doing it?
Not really, but usually the physician who is requesting for these tests may request calcium and vitamin D levels with this test, because usually if your bone density is low, then your vitamin D and maybe your calcium levels are also low.
Okay. Dr. Tasneem, have you ever come across perhaps an expectant mom who wants to do a scan, and is it possible?
Yes, we had one.
Okay.
She wanted to do the scan because her main symptom was the lower back pain. Okay.
Yeah.
So again, with pregnancy is a whole spectrum on its own. Yeah. The lower back pain could be because of the pregnancy. Yeah. From our examination, I don't think there was a fracture. Okay. The pain was manageable with normal treatment. So we told her to wait, let her deliver, yeah, and then she can come for the DEXA scan as we investigate further.
Okay.
Yeah, but again, as he mentioned about the radiation, it's pinpoint. So I mean, we don't have any research whether the pregnant women can actually do the scan or not. So if it can wait, we can wait on it so that we can minimize the little radiation that can be exposed
But
to
that
the
makes
baby.
sense.
So maybe I can just add on that.
Yeah.
There's something called a shielded scan. So what we can do is we can shield the baby, and then we can use the forearm of the mother and do a bone density test using the forearm.
How is this done? How now do you shield?
So the mother is put on a lead gown. Okay. So the stomach is shielded. Okay. And then the hand is placed on the machine. Yeah. And the machine does its job, and you get the bone density.
So that's if you are checking. Okay, let me ask.
Yes.
At which parts of the body does the machine now scan? Is it the hands alone,
So
or even the legs?
So usually the reference points that we use are the lower spine, okay, and both the hip joints.
Okay. Okay.
But if for some reason, for example, if people who have had spinal surgery, or people who have had implants on the hip replacement surgeries, we cannot use those areas. So in those cases, we use the forearm as our reference site.
Okay, and it will now show whatever is going on everywhere.
Yes, yes.
Just using the hand.
Just using the forearm.
Okay.
Yes.
Why are you calling it a forearms? I'm sorry.
So this medically is called the forearm.
No, it's a good. I had to ask because okay, I even thought, am I saying it wrong?
This is the arm.
Okay.
This is the forearm.
Arm and the forearm.
And the hand. Yeah.
And the hand. Ah!
That's medical.
Okay, it makes sense. But I thought the procedure is being done like all through the body. So if you have a fracture on the neck side or the shoulder side,
Yes.
so is it still done?
Yeah, the reference
same way.
sides
Okay.
remain the same.
So the results will bring the trouble is here, here,
Yeah,
and there.
because the bone system is a whole one system.
Ah,
It's not
okay.
like it's very different. So whatever is going on in your lumbar spine represents whatever is going on in your forearm, and vice versa.
Dr. Tasneem, we are talking about this DEXA scan, and I'll perhaps want to know the benefits of it.
So the benefits of doing the DEXA scan is it's the main diagnostic tool for screening for osteoporosis. So I mean, if we can do it early, we all know prevention is better than cure.
Cure.
So if we can pick the disease at osteopenia or something, it would be good. Then as a wellness checkup, yeah, we don't have much clear guidelines because of course there is no research in our setup, yeah, but ideally from the guidelines that we've taken, yeah, from IOF, International Osteoporosis Foundation, we recommend screening for more than 50 years of age for men, postmenopausal women, yeah, and those men who have risk factors and they're 50 plus, definitely they need to come for the scan.
Okay. And
Yeah.
Yeah, Doc, can we use it to find out about any other illness apart from now osteoporosis?
The DEXA scanner can
Yes.
also be used for something called total body composition. It basically, that means that it takes the full body scan and then tells you how much fat you have, okay, total fat, all right, how much muscle you have and how much bone you have, okay. Basically it is used for people who are obese and you know, there are a lot of weight loss options. So before starting a weight loss option, let's say you're going in for surgery, so they'll do a DEXA scan and tell you that, look, this is the amount of fat you have, this is the amount of muscle you have, and this is the amount of bone you had. After the surgery, maybe 3 months down the line, okay, they tell you that they check, are you losing muscle, okay, or are you actually losing fat? And depending on that, then they guide you on your diet. So in many people, they end up losing bone or muscle instead of losing fat. I mean,
Really?
Yeah, they're
Especially
getting
these
thinner.
guys who fast for some days, you know.
Yes.
They end up
Intermittent fasting.
Exactly, intermittent
Yes.
fasting.
Yes,
So
yes.
you need to be keen on what you're losing.
Exactly.
Oh, really?
Yeah. So you can be losing bone, yeah, and you're thinking, oh, I'm losing weight, but at the back of the, you know, you're losing bone, and it's not healthy. I mean, you're killing the bone.
Yeah. And even as we're winding up on this segment, I know that Doc will take us to see how the equipments work and everything, the results. But why is it the case that we don't have enough awareness created around osteoporosis, about the bone DEXA? Why is it the case?
So there is lack of research, yeah, that is available in this part of the world, in
Yes.
Kenya
Yes.
and in Africa. Okay, there are no papers. The Western world, they have done a lot of research on it, and they've actually put guidelines, just the way we have guidelines for HIV or TB or diabetes or high blood pressure. Yeah, we don't have any guidelines for osteoporosis, who should be scanned. It's not part of our national screening program. And we are actually currently doing collecting data, and we even have submitted a research paper, yeah, that we will soon be publishing, yeah. So to tell us what exactly is happening in Kenya in terms of osteoporosis.
Okay, that's a good job to you guys. And we just want to take a short commercial break. We'll come back with more. We'll see this bone DEXA scan and the equipment, how they're looking like. So don't go too far. This is Health and Wellness. Stay tuned.
Hello, my name is Gideon and I'm the radiographer of the day today. And I'm going to introduce you about the DEXA machine. Basically, DEXA is a dual energy X-ray absorbometry. So what happened is, this is the moving arm. It goes over the patients up and forth. And as well as while it's doing, it releases some dose, dual dose, which goes to the bones and the soft tissue. Its attenuations give us the bone density. So today, I want to show you how we do it. And my patient, you're welcome. Hello. Hello, you can have a seat. So we are doing a bone DEXA scan. First thing first, I'll have to do your vitals. I'm doing the weight and height. Weight and height is important because it gives us the BMI. BMI is what guides us all through the bone densities. Okay, so I'll ask you to step up here on the scale. So we're doing the height, the weight first. Then we do the height. Look upright. You're done. You can now step back and have a seat. So we keep the recordings, and our recordings we feed into the machine. Okay, so purpose of doing the vitals are by taking the height and weight. That is to get the BMI. BMI is the body mass index. We get this by calculating the height over the weight. Reason for having a BMI is it gives us the scale that whether you are obese, almost obese, or just a normal height. Normal scales ranges from 24 to 35. Having done that all, we'll need our patient to lie down. So you can lie down, hand goes there. Yeah. So the patient is positioned to lie down on the bed, precisely at the center. Having positioned that, now on bone DEXA scan, we are starting with the femur. We do the femurs and the spine. For our positioning for the femur goes this way. Let me demonstrate how it does. So feet apart. Then I place this point in between the legs. Reason for doing this is to position the femur in its true position. Because our concern here is the femoral necks. That's where we pick our densities from the bones. Having done that, we are well set. So we get to the machine. As I had explained earlier that this is the arm which do the scannings. It moves across over the patient's body, back and forth. At the same time, irradiating the patient. Produces a small dose radiation dose. This is my reader detector which picks the attenuations from the soft tissues and the bones. Let's start. So basically this is how the scan goes by. Patient position in a sleeping position. Yep, this is the AP position. No movement at all. Patient remains calm. Moderate breathing. And there we are. So on our positioning, we make sure the patient is on the center. Here's my calibration light, positioning light. So as I had earlier stated that we are starting with the femurs. So we select each and every femur. We start with the left. Make sure it is well positioned correctly. Make sure it's in its true anatomical position. Once you're done, confirm it from the console. Do the right femur, the same thing again. Make sure it's in its true anatomical position. Confirm it while set. Configure it on the console. Then we're done with that. Now the next part is the spine. On the spine, we position to the spine. Patient remain in the same position. Now the different part is we get a true anatomical position of the spine by removing the thing that was on the femur. So here we position the patient. The arm still moves. Patient will still remain in the same position. Make sure that is well aligned at the center. We don't want to miss anything. We want to capture everything. Okay, once we are set like this, and we start our positioning. So here's how the scan goes by. So this arms moves and the radiation starts, the scan starts. So here's how the X-ray detector moves. Okay, once we are done, it goes back to its normal position. So our image acquisition is now done. So the next thing now is to observe the images that we acquired. So we are done with the patient. The patient can now change back and leave. Having acquired the images, so next part we are doing the FRAC score. FRAC score is the 10-year probability of having a fracture. So the machine calculates, but before it does that, there are a few questions I need to ask my patient. Okay, here we start. So hi.
Hi.
So we are done with the scan. I'm going to ask you a few questions. Need to put them on the machine.
Okay.
Then we get your FRAC scores. Once we are done, you're free to go. You can continue to your daily routine, okay? Okay. So my first question is, have you been taking alcohol?
Yes, occasionally.
Occasionally. How many pints per day in a week?
3.
All right.
Okay.
Are you currently smoking?
No.
Okay. Ever had a previous fracture?
Yes.
Does any of your parents ever had a hip fracture? Hip fracture, one of your parents?
No.
All right. Are you on any corticoids?
Yes.
Okay. Which one? All right. Ever diagnosed with rheumatoid arthritis? No.
No.
Are you on any terminal medication? Long-term medication?
No.
All right. So we are done with the question. So the machine will calculate for us. Let's do the calculations. What is done with the calculation, I'll call upon Dr. Tasneem to come and take us through the results. Okay, thank you for your time. You can go out there, continue what you're doing. You'll get the results in 15 to 20 minutes, okay?
Okay, thank you.
So we are done with the image acquisition. We've reconstructed all the raw images. Now I want to invite Dr. Tasmin, he's our osteoporosis specialist, to come and take us through the results.
These are the printed version of the report. Yeah, they're normally 3 pages depending on what we extract from the computer. So first we have the FRAC score. Yeah, FRAC score is a tool that is used to measure the risk of getting a fracture in the next 10 years. Okay, so as we can see here, for this patient, the FRAC score for major osteoporotic fracture is say 1.74, and for the prediction of a hip fracture is 0.01. So the relevance of this, when the major prediction of the major osteoporotic fracture is more than 20%, or the prediction of the hip fracture is more than 3%, that is when we need to intervene or start the patient on treatment. Okay, so the few questions that we look at and we really focus on is alcohol, smoking, fractures, any history of steroids in the patient, rheumatoid arthritis, and secondary osteoporosis. Then we had scanned the lumbar spine, the whole anteroposterior spine, yeah, and that is from L1 to L4. Okay, so in simple languages, as you can see, there is the normal, that is green, there is the yellow, that is osteopenia, and then the red, that is osteoporosis, red for danger. Okay, so if the patient lies in yellow, in green, that means the patient has a normal bone mineral density. So normal bone mineral density values are anything above -1 and above. Okay, for osteopenia is between -1 and 2.5, and anything below -2.5 is osteoporosis. So as we can see here, this is a normal bone, this is osteopenia, and this is osteoporosis. And here the patient is, here as you can read here, me, this is where the patient is falling. Then we had scanned the right and the left hip joints. Okay, so we have the values for that. So at the right femur we have the value of the neck T-score and the total T-score, and at the left femur again the neck T-score and the total T-score. Our concern are the neck bone mineral values. Okay, so again this patient, there is the green, which is normal, anything above -1. From -1 and -2.5 is yellow, osteopenia, and -2.5 and below is osteoporosis, meaning danger, meaning you need to intervene or rather start the patient on treatment. Okay, so the most common sites for doing the bone mineral densities are the spine and the hip joints, the right and the left. But there are sometimes when some cases or some disease states may not allow us to scan those areas, but the machine can have an alternative. So we can either measure the BMD at the wrist, so basically the forearm, either the right or the left. Sometimes a patient might have a prosthesis or a hip implant or a metal plate or something in one of the hip joints. We can still do the other side of the hip, or we can do the wrist or the lumbar spine. The other thing sometimes we may need is to investigate the lateral spine. Let's say a patient had a fracture, or maybe the patient keeps having lower back pain, and as we know, osteoporosis is a silent disease. So by the time patient presents to you, either they already have a silent fracture which they don't know about, thinking it's just low back pain, chronic low back pain, you know. So we can actually investigate and look at the lateral spine. So it's the same procedure, but you just maneuver around here and then measure the lateral spine or the vertebral spine. The printed reports are then given to the patient, that is attached with the radiologist's report explaining the same, and the patient can thereafter take it to their healthcare provider. Thank you.
Well, thank you so much, Dr. Tasneem, for this insightful information about the bone DEXA. And they say, when the heat is too much, you get out of the kitchen. That was me today, because some pretty intense stuff over here, but we've learned how the procedure works, how the mechanism is done, how the results are generated, and anyone out there is now equipped on what to do when they come here. So thank you so much. And in case they want to find you, where can they find you?
We are at Rehan Healthcare on Park Medical Center, first floor, on 3rd Parklands Avenue, just right opposite Aga Khan in Nairobi.
Good, good. Thank you also so much to you, dear viewer, for tuning in from the start until the end. It has been health and wellness. In case you missed this episode, find it on YouTube at KTN Home. Our handles definitely at KTN Home on X, Instagram, and on Facebook as well. Find me at Ali_Zaitun on Instagram and at Zaitun Ali on Twitter. Until next time, see ya.